In the early 20th century, the remote village of Poli Ad was shrouded in superstition and isolation. Nestled deep in the forest, its 200 residents relied on folk medicine and ancient rituals. With no electricity or modern infrastructure, the community was tightly knit, but deeply suspicious of outsiders. The village's wooden huts and fog-covered fields created an eerie atmosphere, perfect for the unfolding mystery. During the annual harvest festival, 16-year-old Amina suddenly collapsed, her body convulsing violently. Witnesses described her eyes rolling back as she foamed at the mouth. The basket of wild berries she'd been carrying scattered across the dirt. Villagers interpreted this as a spiritual attack, noting that Amina had wandered near the cursed section of the forest days earlier. Panic began to simmer. Within 48 hours, 6 more girls exhibited identical symptoms: twitching limbs, loss of consciousness, and incoherent speech. The village healer, Mama Nia, blamed evil winds from the forest. Parents locked their children indoors, while others hung protective charms. Notably, all affected girls were aged 12 to 18 and had attended the festival. The seizures seemed contagious, though no physical contact occurred. As cases reached 15, the village turned on Siti, a reclusive widow rumored to converse with spirits. Torch-wielding men dragged her from her hut, accusing her of poisoning the girls. Historical records show similar scapegoating during Europe's medieval witch trials. Siti's protestations were drowned out by chants of "burn the witch," a chilling parallel to global patterns of mass hysteria. Dr. Wijaya, a Dutch-trained physician from the colonial outpost, arrived after a 2-day horseback journey. He noted the girls' dilated pupils and erratic pulses, but found no fever or infection. Intriguingly, their symptoms worsened when villagers discussed the curse. This observation hinted at psychogenic illness rather than biological causes, a hallmark of mass hysteria. Dr. Wijaya discovered all affected girls had consumed devil's berries, Belladonna, from the forest. These contained tropane alkaloids causing seizures and hallucinations. However, the dosage was too low to explain the epidemic. His journal revealed a critical insight. The girls' belief in the curse amplified the berries' effects through the nocebo effect, a psychological phenomenon where negative expectations manifest physical symptoms. Despite the doctor's explanation, 5 new cases emerged purely through psychological contagion. Girls who'd merely seen the seizures began mimicking them, a documented behavior in mass hysteria outbreaks. The village elder Pak Harjo dismissed Dutch science, insisting only a ritual could break the curse. This clash between tradition and modernity escalated tensions. At midnight, the village performed a fire purification ceremony. Masked dancers circled a bonfire, chanting to banish spirits. Anthropologists note such rituals temporarily reduce anxiety and collective trauma. Remarkably, seizures decreased afterward, not from supernatural intervention, but because the ritual provided psychological closure, easing the nocebo effect's grip. Dr. Wijaya confronted Pak Harjo at sunrise, presenting European case studies of mass hysteria. He emphasized that blaming Siti only deepened trauma. Reluctantly, the elder agreed to stop persecuting her, but refused to renounce spiritual beliefs. This uneasy compromise reflected broader colonial-era struggles between indigenous knowledge and Western medicine. A month later, seizures ceased, but Poli Ad remained changed. The girls recovered physically, yet villagers avoided the forest and whispered about the year of the shaking sickness. Modern psychologists would classify this as a textbook case of mass psychogenic illness, where stress, suggestion, and cultural beliefs create real physical symptoms without organic causes. The episode left scars deeper than science could heal.